Herkese merhaba, ben Doktor Aynur Şahin, Karadeniz Teknik Üniversitesi Tıp Fakültesi AC Tıp Anabilim Dalı öğretim üyesiyim. Bugün ACİNet yazı serilerimiz kapsamında ToxMed'in ilk ToxTalks sohbetlerinin ilkini gerçekleştireceğiz. Ziad Kazzi'yi ile beraber. Kendisi MR Üniversitesi AC Tıp Anabilim Dalı öğretim üyesi, aynı zamanda Uluslararası Tıbbi Toksikoloji Yan dal programının direktörü. Hi Dr. Kazzi, it's our pleasure and honor to have you for this interview. Thanks so much sharing your time with us despite your really busy schedule. First of all, I would like to introduce you with a short bio of yourself before the questions. And I have full belief in that this interview will enlighten for those who are really interested in medical toxicology and also those who wants to be a toxicologist in the future. So Dr. Ziad Kazzi'yi is a professor of emergency medicine at Emory University in Atlanta, United States. He is a medical toxicologist as of 2003 and currently director of International Medical Toxicology Fellowship Program at Emory University. And he is also assistant medical director of Georgia Poison Center for more than 10 years. He is the founder and the past president of Middle East North African Clinical Toxicology Association. And currently he is the secretary of American College of Medical Toxicology. He mentored more than 15 international fellows in medical toxicology, and luckily I was one of them. And he supports and works non-stop for the development and recognition of medical toxicology as a subspecialty under the division of emergency medicine. He has many publications, projects, grants with global collaborations. He is really doing an amazing job. Thanks so much, Dr. Kazzi, for sharing your time.
Teşekkürler.
Thank you. So my first question is, can you describe us the definition of medical toxicology and its history, like how it became a subspecialty in the United States?
Absolutely. Medical toxicology is really a broad medical specialty, but really it centers on the prevention and the care of people who are exposed to poisons. That's kind of the broad term, but really any chemical or pharmaceutical natural toxin, say, if it's coming from an animal or from a plant, as well as exposures to substance of abuse, poisoning with radiation, exposure to radiation, contamination of radioactive material. As you see, it's a pretty broad medical specialty. It also covers a lot of different settings, whether it's occupational, environmental, accidental, intentional, say suicide attempts, and even in emergencies, whether it's if you're having, for example, a disaster that involves the release of chemicals or a terrorist attack with the use of chemical agents. It's a pretty broad medical specialty. Now, as a medical specialty recognized by the American Board of Medical Specialties, this was not something that was available for us until the late until the early 90s, when it became recognized as a medical specialty by the American Board of Medical Specialties. Of course, toxicologists started practicing clinical toxicology in poison centers. That was one of the first things that happened was the creation of poison centers in the US. As well as in Europe, there were some poison centers being created across Europe. And the poison centers were the birthplace of, I think, the medical specialty of medical toxicology. Initially, this was basically physicians who are working at a hospital, seeing patients that are poisoned or children that were poisoned. So they were basically trying to figure out how best to take care of them and prevent the poisoning from the first place. So they started creating these small poison centers that were hospital-based. The first one in the US was in Chicago, for example. And as time passed, these poison centers increased in number. and they were now linked up through the American Association of Poison Control Centers. At the same time, you had the creation of the American Academy of Clinical Toxicology, which brought together, the medical toxicologists, the physician medical toxicologists, as well as the pharmacists who are also practicing in clinical toxicology. And together, they really pushed the field forward to the American Association of Poison Control Centers and the American Academy of Clinical Toxicology. Fast forward, you had the creation of the American College of Medical Toxicology, which was really focused on the physicians who are, the medical toxicologists. And now, as you know, in the United States, we have both ACMT, you have the AACT, and then you have the American Association of Poison Control Centers, APCC. In Europe, you had the creation of the European Association of Poison Control Centers and Clinical Toxicologists, that's EAPCCT. Fast forward until 2006, we started looking at the question of clinical toxicology in the Middle East, North Africa region. That led to the formal creation of the Middle East and North Africa Clinical Toxicology Association, MINATOX, in 2010. So this is where MINATOX took its place in the MENA region as a specialty organization for clinical toxicologists.
Okay. My next question is, what are the official and potential responsibilities of being a medical toxicologist?
Being a medical toxicologist, and here I'm defining this as a physician who's a clinical toxicologist, you are really, involved in the care of patients that have a medical toxicological illness. Okay, so that's a big piece of it. The clinical care. You assess the patients. You examine them. You get a history. You obtain diagnostic studies. You have an assessment and a management plan. That is a big piece of what we do. And these medical toxicologists are usually based at a hospital. They're in the emergency department, but they also see patients in the hospital, in the intensive care unit, in the inpatient wards. We also see patients in the clinic, in the outpatient setting. We have outpatient environmental and occupational clinics. We see people that are exposed to chemicals at work or environmental exposures. We do the same thing. Now, because poisoning can be prevented, medical toxicologists also have an important role in preventing poisonings. How do we do that? We do that in a variety of ways. One could be through, working at a poison center, where you are educating about safe storage of chemicals, for example, or proper packaging of medications to keep keep children safe from opening these bottles of medications. Public health functions, public health prevention of poisoning, whether you work with the Ministry of Health, that's an important role, potential role for medical toxicologists. Some medical toxicologists also work with industrial companies. If an industrial company makes pesticides, for example, they would have a medical toxicologist to help them, translate the science from the bench to the bedside. From the bench, from the lab to the field, the farm, and make sure it's safe for people if they're exposed to these pesticides, for example. There are medical toxicologists working for pharmaceutical companies to help them with the toxicity of drugs. There are medical toxicologists that are working in addiction medicine nowadays in the United States. Because we have an opioid epidemic, we don't have enough addiction medicine specialists. Medical toxicologists saw in that field the overlap in their expertise in managing withdrawal, because we also manage opioid withdrawal, benzodiazepine withdrawal, alcohol withdrawal. So they saw that expertise overlap, and they learned some more training about the addiction medicine per se, and treating it with medication therapies like Suboxone, for example, or buprenorphine. That's a new field. We've also seen medical toxicologists like myself, as you know, interested in radiation emergencies. Again, this is another area of medicine that doesn't have a formal specialty that cares about it or cares for it. So medical toxicologists, again, have taken up interest in radiation emergencies. So as you see, there are different roles for these toxicologists. Some medical toxicologists work with in the clinic only. They're the outpatient clinic, and they also get involved in legal cases where they provide consultation to lawyers in the court if there's a medical legal case that involves poisoning or some sort of adverse drug event. So it's really pretty broad, as you know.
Yes. So as you are a director of a subspecialty program, can you provide us the details of training process and the role of poison centers in medical toxicology fellowship programs?
Excellent. That's not an easy question, because when you think about training for to become a medical toxicologist, you have to realize that it's not something that's available in every country in the world. Okay, in the US, it's available. There are about 30-some fellowship programs. There are some fellowship programs in Australia. There's a couple of fellowship programs in Europe, a handful of fellowship programs in Europe, not as formalized. Depends where you are in Europe. For example, in the UK, you have some formal programs, but sometimes formal training of a physician, for example, with another medical toxicology mentor in a hospital, leading to a fellowship training. And this training, must include patient care, a bedside experience, as well as provide the experience to a poison center, because the poison center will give you more cases, more experience. Because if you're going to sit in one hospital and wait to see all your cases at the hospital, maybe the volume is not going to be sufficient. This is why the poison center is a great way to get more cases from the entire state or the entire country. It gives you more experience that way. Also will help you learn about how to prevent poisonings, how to educate about poisonings and preventing poisoning. So that's why the poison center is essential that way. Also teaches you emergency preparedness principles. It can provide you opportunities to interact with your health department on preventing poisonings or managing chemical emergencies, educating the public, educating other healthcare providers. All of that is important in your training, in addition to research. So there's also a component of scholarly work that you do, a research project during your fellowship. Again, you have to attend regular lectures by your teachers, participate in national, international conferences. It's a pretty busy fellowship. And again, you also have to have that clinic. As you remember, when you were training, you had, to go to the clinic once a week, see patients in the clinic. You also have to round every day, work at the poison center and help with the follow-ups on the admitted patients already, take call for the poison center, help the poison center specialists manage cases when they need your help, and then do research and teach other students and other residents, rotators, about toxicology.
Yes. And as you know, medical toxicology is not a recognized subspecialty in Turkey yet, but we have a great potential, So what do we need to do for the recognition of medical toxicology as a subspecialty, and which steps do we need to take?
I think it makes a lot of sense for a great country like Turkey, with one of the most developed emergency medicine residencies in the world, to have a subspecialty in medical toxicology under emergency medicine. I think it'll make a lot of sense, because I think, as you know, emergency medicine in Turkey is well recognized and well developed. So it's a natural cradle or natural environment to develop the subspecialty of medical toxicology. I think it'll be important to do that, because then you can train more people in Turkey. As you know, you were the first one that was trained formally, and you trained with us in the US. At this point, you need more people like you. Just one person or two people or three people, let's say, you have in Turkey is not enough. You need to have more people, and the best way to do that is through your own fellowship programs. Turkey already has a good body of toxicology science. People publish about toxicology because, you don't have to have a specialty to see patients show up in your university department with poisoning. So yes, poison patients are being cared for today in Turkey very well. But I think medical toxicology is going to just improve it beyond what it is right now. It's going to also affect, maybe caring for them in a better way or in a better cost-effective way, more aligned with standard of care, international standard of care. Also, the medical toxicology specialty is going to help prevent poisoning maybe in Turkey, understand the profile of poisonings in Turkey and what areas need to be looked at more carefully. You also potentially have the capacity of keeping people at home, not coming to the hospital. If you can manage them, provide medical advice on the phone to these families to stay home if they don't need to come to the hospital and save hospital visits. So certainly a lot of benefit will result from recognizing the specialty in Turkey, defining its curriculum, of course, and setting up fellowship programs and starting to graduate people locally.
I totally agree. And I wonder, what do you think about the medical toxicology inpatient unit? I know that you only run telemedicine consultation and bedside consultation, not under a specific unit. And I wonder, what do you think about it?
I think it's a model that we have in the US. There are a couple of programs in the US that admit their own patients. And certainly it's got its advantages because you are more in control of your patients. You're not just a consultant. It comes with its own challenges, though, because you have to be able to manage the entire spectrum of issues that the patient has, social issues, infectious complications, say they're intubated, develop a pneumonia, other things can happen as well. So it's challenging, but it has its own rewards. Certainly, it's not something that's unusual to have your own inpatient service. And I think it's a good idea if this is your setup and what you have interest in.
Sounds good. And can you provide us more information about ACMT and MenoTox and their goals?
Absolutely. I think ACMT and MenoTox share a lot of goals. I think the goal here is to, care for patients that are, poisoned, improve their care, prevent poisonings, also, improve the recognition of the specialty of medical toxicology amongst other specialists and the public, really, because we are a membership-based organization. Both of these are membership-based organizations. So they are going to be really interested in supporting our members, supporting our member needs, whether it's with resources, education, recognition, and also to promote the best research available, and either to conduct research yourself or support it or encourage it. So that's another very important piece of what we do. And finally, advocacy, advocating for proper laws and regulations to protect the public from chemicals, or that's also important for both organizations. Now, ACMT is a nonprofit organization in the US. It does have an international committee, the ACMT International Committee, which I chair. So we do have international members, and certainly I invite any of our viewers to consider learning more about ACMT at www.acmt.net. Also, we have a large research network in the US on the toxic registry that is also of interest potentially for international members. And then we do the annual conferences and webinars, regularly scheduled webinars. MenoTox is focused on the MENA region, as you know, and we also have members, and you can join MenoTox by checking our website at menatox.org, menatox.org. We also have an annual conference. We have regularly scheduled webinars. It's a small organization. MenoTox is smaller and is growing and is developing more and more resources. I know you, Ainur, you're in charge of one of our educational resources that you're working on. So And of course, there's the European Association of Poison Control Centers and Clinical Toxicologists. That's another association that is important. And then the AACT, the American Academy of Clinical Toxicology. These are the four organizations. There's also APAMT, Asia Pacific Association of Medical Toxicology. And then these are the main, organizations that people can check out and consider joining.
Thank you. And last but not least, I know you are inspiring most of the toxicologists in the region, and I wonder what inspired you to be a medical toxicologist and encourage the others in this field?
As I was training in emergency medicine at Emory University, I was always, impressed by the medical toxicology faculty that were emergency physicians as well. I thought they were always knowledgeable about mechanisms of what we're doing every day in emergency medicine. They knew why these things were happening. They knew how this medication worked better than anybody else. I felt that they were really, deep in their understanding of emergencies. So that was my first encounter with that. And then the second thing was that, as an emergency physician looking for a subspecialty, so I knew I wanted to be an academician. I was really attracted to the science. The science is so broad, and it's actually really fun. It's interesting to read. Like when you sit there and read about toxicology, you don't get bored, because the topic is fascinating. There's a little bit of history about this poison. There are historical incidents that are fun to read. In some cases, there's mechanism that's really cool, and then there are management opportunities, including antidote use, and this population of patients that we see. Many of them are preventable illnesses and injuries. So you can potentially make a difference. Sometimes you feel like you can make a big difference in someone's life. So it's very rewarding that way. And it makes you a specialist. One of the issues with emergency medicine is we know that we are, we know about everything, but only like the first 6-8 hours of the presentation and management. Medical toxicology gives you that specialist hat. So when you're walking around the hospital, another colleague will see you and say, "Hey, can I ask you some advice about this patient?" So you get these mystery cases as well that sometimes are toxicology, sometimes they're not, and you get to evaluate them and help your colleagues. So that's rewarding. Also, it gave me all these other opportunities in clinic and radiation emergencies, public health. It really opened up a lot of opportunities for beyond just emergency medicine, which is sometimes working in the emergency department or teaching in a residency program. It's really been great to do that. And it's been really satisfying to me to see our graduates and others who are training in toxicology in the region. It's been really very rewarding to see MINATOX grow and see the specialty, developing in various countries in the region. I wish the best for Turkey under your leadership and the leadership of your other emergency medicine organizations in Turkey. I'm sure all of you together will move forward and make Turkey one of the leaders of medical toxicology in the region and the world.
Thanks so much, Ziad. As your former fellow, your colleague, your friend, I'm always happy and proud to collaborate with you. And I'm also really happy to announce that Emory University and Karadeniz Technical University will make a big collaboration in terms of a project which is based on telemedicine consultation and training in medical toxicology. So it's really important for all of us to take a big step for medical toxicology. Thank you for your all support. See you soon.
Thank you so much for having me today.
Thank you. Bye.